going to be the most prominent bone. But if you couldn't see them, if somebody had more soft tissue, you could find their iliac crest, just like we did for PSIS, and sort of work your way around until you came to the bony prominence. And that's going to be her ASIS. I didn't list it on the slide because I think it's too hard to palpate and too deep. But there's a reference to where the rectus attaches just inferior about an inch and a little bit deeper. We would find the anterior inferior iliac spine. I can't find it. I'm not confident, so I didn't put it on your list. But just know that it's about an inch inferior to the ASIS.
What muscle attaches to the AIIS?
Rectus femoris.
Thank you.
Ask us more questions.
Okay, so here's a technique I like to use for the pubic symphysis or the pubic tubercle. It's called both things. I say, Katie, can you find your pubic bone for me? Perfect. Can you just leave your hands there? And then I go find it, right? Because I don't want to be digging around and trying to find it and be in the wrong place. And it's always best to come from top down, because then you're going to get abdominal pubic bone. So then I just come in right where she moves her fingers, and then I'm going to palpate, and I can feel the pubic symphysis or pubic tubercle, whichever you would want to call it. Okay, so that's, I find, a really easy way to do it. Just ask your patient to find it. You can even, and they'll say, "What's that bone?" You say, "The bone right here, your pubic bone. Can you find your pubic bone for me?" Okay, and then you put your hands right in. So that's a safe bet. And then we're just going to move lateral to that, and we'll find the pubic ramus. Okay. So always, I think that's just a great way to start, is have them find it for you. It's usually, it can be tender. It can be a very tender spot. Once you find it, you can't miss it. Okay, so let's go greater trochanter. So it's important to know where the iliac crest is, as we're going to come from the iliac crest and work our way inferiorly till we feel a big prominent bone. Round bone, that's the greater trochanter. We found it already in the lumbar lab, right? Because we were finding the attachment for the piriformis. I'm not in a great position, but one way to confirm that you're on the greater trochanter is to internally and externally rotate the patient's hip, and you'll feel that bone moving underneath your fingers. Okay? We're gonna do all of the hip bones, and then we might do all of the knee bones. And then we'll break out into lap, and then we'll come back for soft tissue. All right. Last one's Ischialtuberosity, so go ahead and come on your right side for me. So you can do this one either in supine or in prone. We're going to bend your knees a little bit. And so we're going to find the greater trochanter, and we're going to go posterior and inferior. What attaches to the Ischialtuberosity? Hamstrings. Muscles. Hamstring. Okay, what ligaments attach there?
We know one.
Ischial-femoral. Okay, good.
Yeah.
All right, so we're going to palpate greater trochanter. We're going to go posterior and inferior until we find the Ischialtuberosity. An alternate way, not in the book, is to come kind of up the medial thigh until you palpate the sit bone. So either way, inferior and posterior from the greater trochanter, or up the medial thigh until I feel a prominent bone. That's my Ischialtuberosity. So what could we have her do to confirm that we're on that? Yeah, she could flex her knee. Wow, that was your hip. Bend your knee into my hand. Good, and relax. And I should feel a muscle pop up underneath my hand. If I don't feel anything, then I'm not on the Ischialtuberosity. Okay? All right, so that's hip bony palpation. Any questions over those? They're not that